revolution that has taken place in the health sector in Ondo State since the inception of the Dr. Olusegun Mimiko-led administration could be best described as a fallout of the commitment of a man to an unprecedented mandate ever freely bestowed on any elected public official in the annals of the state. This was what prompted him to vow that exceptional and qualitative healthcare will be available to the people where they live, work and play. With a cognizance of the stark reality that Ondo State was greatly lagging behind in the health sector, it all began with a homegrown Abia Safe Motherhood initiative piloted at a federal local government area of the state on November 28, 2009.
Every pregnant woman in the federal, we have a name and a number. That's number one. Number two, àwọn òbí tó ń gbé adẹ̀ tí wo gbogbo ìfẹ́dọ̀rẹ́ ní map ní Ìgbàrà Òkè, ká sọ pé Ìgbàrà Òkè area 1 tó bá jẹ́ 50 pregnant women ló wà ńbẹ̀. Àwọn kan wà tá a ti train, we call them health rangers. The health ranger will be assigned to this cluster. The health ranger will be responsible for those people in the cluster. Second cluster, 50 people around there, health ranger, this number. 100 people, health ranger. And our health rangers say, wọ́n ti kọ́ wọn, wọ́n á ní motorcycle, lẹ́yìn motorcycle wọn, gbogbo nǹkan tó lè fi gbẹ̀bí ọmọ ní emergency ló wà níbẹ̀. Then they will go for each of these cluster of people. One more health ranger because they will be visiting you at home.
Government also provided the pregnant women with GSM phones to facilitate smooth communication and prioritized the renovation of existing health facilities, upgraded some into comprehensive health centers and built new ones, while ambulances and motorcycles were brought to ease the job of the rangers. To complement this, purposefully built mother and child hospitals came into being to offer referral and free services to the comprehensive health centers and treat pregnant women and children under 5. The premier hospital is located at Okaro in Akure, the state capital. The second at Ondo town, while other communities are being considered.
Our homegrown ABA program, which we started in partnership with the World Bank, has put Ondo State on the world map and is now being replicated throughout the state and emulated by all and sundry. Meanwhile, the pioneer mother and child hospital in Akure that started as the Apex Referral Center for BA evolved into perhaps the only tertiary facility in Nigeria offering free services, including free consultations, admissions, drugs, surgeries, and blood transfusion, irrespective of ethnicity, social status, or place of residence. On the prestigious London School of Hygiene and Tropical Medicine's global accreditation list of hospitals treating excessive bleeding after delivery, the medical jargon known as postpartum hemorrhage, our own mother and child hospital Akure was elevated from being number 107 globally in January 2011 to number 1 in September 2012, a record-breaking feat.
The recommendation is that for the world to achieve MDG 5, I'm talking about MDG 5 now, which is reduction of maternal mortality. Talking about that, nations, globally, we must reduce maternal mortality ratio by 5.5% if we are going to ever achieve that. Now, globally, what we are doing between 1990 and 2010 suggests that we are declining, in terms of maternal mortality ratio, by just 3.1%. All right. So globally, it is said that we may not even be able to achieve MDG 5. But because of the uniqueness of the program we have in Ondo State. If you look at our own data here, we have been able to achieve 23% average reduction in maternal mortality ratio, which suggests you are doing 10% more than, almost 10% more than the rest of the world.
Statistics revealed that as at June 2013, over 8,649 pregnant women have been registered, while there were 3,028 safe deliveries, and the programs has now been replicated in the remaining 17 council areas of the state with the following achievements. This in addition to the over 105 well-equipped basic health centers that now dot the nook and crannies of the state.
London is falling down, London is falling down, my dear lady.
Gloria Aina is the first baby at the Mother and Child Hospital, Akure.
Being the first woman to give birth in that Mother and Child Hospital, I was very happy. And the doctors and the nurses, they really tried for me. They run around just to make sure that the baby and the mother was saved by that time. Because my condition by that time, in fact, was the grace of God and how the doctors, the experienced doctor, they were gathered to make sure that I and my baby was alive by that time. And to talk about the equipment, the modern equipment that are there, in fact, I appreciate this Mr. Governor.
Deborah Fakpe from Ipogun, a village close to Akure, the state capital, have spectacular testimonies, having escaped death from the pangs of maternal mortality thanks to this initiative.
Wọn kò jú mi rí pọ̀ o, àmọ́ èmi fúnra mi líbímọ kẹ̀jẹ́rì bleed gbẹ̀nà fún wọn olóbì nínú kàrẹ́ wá kàn ká fún mi lẹ́jẹ̀ 14 ọmọ wọn tíjọ́ mẹ́ta kẹ́ ti dákẹ́ kìmí èdè yàgbẹ́ kó ṣe mo yàgbẹ́ lódìdí oṣù kọ̀ mi ló pampers kàn dì mọ́ di mi ẹ̀sùn kò jú mi ṣe àmọ́ àwọn dókítà wọn tíráì lé mọ́dà ṣáàjì wọn tọ́jú mi gan-an wọn tíráì gan-an. Mo dúpẹ́ lọ́wọ́ Ọlọ́run gan lóríire kan ṣe kò mí ẹ̀mí mi dẹ̀ wà láyé mo dẹ̀ bọ̀bọ̀ àyàn ọmọ mi láyé àlàáfíà. Mo dúpẹ́ lọ́wọ́ ìjọba Mimiko kó tọ́jú mi òun ni mo dúpẹ́ lọ́wọ́ rẹ̀. Wọ́n gbé ó lọ mi o wọ́n gbé ó lọ ní lébẹ̀ kété nǹkan ṣe kò mí ẹ̀sùn gbé kan ṣe àmọ́ mú mi sí mi lára ẹ̀sùn gbé kan ṣe àmọ́ tọ́jú mi ọ̀fẹ́ lí kété rẹ̀.
Well, my baby was small, very small. It came out as 0.9 kg, and right now the baby is improving, and my baby is 1.5 kg now, and I'm very happy. The very first day I saw the baby, they said I should carry the baby. I was like, where do you want me to touch her? I started crying because it was so small. There was nothing to hold. You understand? A 7 months and 2 weeks old baby. It was so small. I felt for the baby and I cried. I cried and cried and cried, but they insisted that you just need to bond with your baby. You need to carry this baby.
Initially, I was very skeptical about the whole issue because I wasn't all that comfortable. Though I've been hearing of mother and child, but I've not been here physically. But when I got here, the day they admitted that when I got here, I saw the state-of-the-art equipment that is here. It's so marvelous and it's second to none.
Today, the statistics speak the success story, and more partnership from home and abroad have continued to roll in. On immunization, the state won the 2012 Nigerians Immunization Leadership Challenge sponsored by the Bill and Melinda Gates Foundation, complementing the state's polio-free record since the advent of the Mimiko-led administration in 2009, a feat achieved through a robust commitment to routine immunization and local immunization plus days, as well as the maternal, newborn and child health week. This was complemented with the launch of Orirewa Ondo routine immunization, reaching every ward always, to ensure community ownership, and participated in immunization and commissioning of the ultra-modern cold chain store built at Akure in Akure for proper storage of the drugs and immunization materials meant to drive Orirewa to a point of success. To give effective coordination to these plethora of activities revolving around primary health care, government established the Ondo State Primary Healthcare Development Agency under the supervision of an executive secretary.
We're focusing mainly on for MDGs 4 and 5, the scaling up of the ABA, which is on. It's our primary responsibility in this board to ensure a successful scale-up of the ABA. And with what we have started, with funds being made available, like now we've started last month to begin to reimburse LGAs based on antenatal visits and deliveries reported. And this has, as we have observed in the past 2 weeks, been a great motivation for the LGA primary health facilities, because now activities in terms of antenatal care and delivery has come alive with our supportive supervision, because we're trying to implement the principle of performance-based. We fund you based on your performances.
Born out of the dire need to reduce mortality by road accidents, which is the 6th highest cause of death globally, government conceptualized the Accident and Emergency Trauma Center, which is second to none in the country, and organized series of training for staff of the trauma center, nitty-gritty of the functionality of the high-tech ambulances procured for the program, as well as trained over 200 extricators and paramedics and 60 information managers to man the information call center. The Festival of Surgery has relieved hundreds the burden of surgical amendable diseases which have held them down for years. The total number of indigent persons who have regained their sight have scaled up to 400, another 3,000 for those who got free eyeglasses, while medical assistance for indigent persons to advance their care at home and abroad have hit a record high of over 500 million naira.
We have started, and we are doing quite remarkable and profound surgery have been taking place in our medical village, where we have our trauma and surgical center. Before, we know how much we have spent giving to people to go for dialysis. Now we have our own kidney care center, so we won't have to spend on that again. We can offer some level of assistance for indigent people who are unable to afford it, and we know they are genuine in their intention. We will then send them to our kidney care center where they can have dialysis because we have state-of-the-art equipment there. Again, with our trauma and surgical center, we're doing quite a lot of surgery, spine surgeries and all of that. So we have in our medical village facilities, and we offer world-class services in a world-class environment, and to ensure that we offer the qualitative health care to the good people of Ondo State.
All these interventions have not only brought remarkable success stories for the government and commendation from local and international partners, but has also brought harvest of awards for the governor over his health policies.
Well, I have to say I'm very, very impressed with what I've seen. The fact that this hospital is exceeding the Millennium Development Goals is obviously of real significance, and it's bringing great benefit to maternal health and to child health as well. And I think if you put that together with the effort that is going into building mega schools here, and the governor's emphasis on education and health for children and young people and maternal health, you have a very good foundation for further development in the state, because without good health and without good education, no community can survive. And it's obvious that in Ondo State, health and education are really flourishing.